My name's Shane Drew and practice is Drew Dentistry. I never really wanted to be a dentist, to be honest with you, because my dad was a dentist. My true passion has been ceramic art. I've always wanted to be a potter. So I went to school and started studying art. But my dad wouldn't help pay for any college unless I did a science major. Realized I was really good at science in school. After college, I still didn't want to be a dentist, but I had a dual degree in art and science. When I did start shadowing dentists, including my dad, I really realized that dentistry was a true melding of art and science, and it fit perfectly. I was book smart. I can work with my hands really well. I like with people. I didn't want to be in a research lab anymore, so I applied to dental school, and the rest is history.
What do you do with patients at your practice who don't like going to the dentist? How do you mitigate pain? How do you overcome some of those things? Tell me about that.
Yeah, I mean, it's uncomfortable for me to go to the dentist and me to go to the doctor, but we start it from the very beginning. From the moment you call our office, our receptionist is gonna walk you through everything. If you can't get it done prior to your appointment, we'll literally sit down and walk you through the paperwork in our office. We like to do a lot of tell, show, do. So we're gonna tell you what we're gonna do before we do it. We're gonna walk you through it. And if you don't wanna hear anything, we won't walk you through it. But pain is just not a thing in my office. If you're feeling pain in the dental office, we're not doing our job. It's really important to do your routine checkups. Oftentimes, there's a lot of small problems that are brewing. I wouldn't say we're watching them, but the small problems are easily fixed if we see them when they're small. Unfortunately, most of these things are asymptomatic, meaning they don't hurt while it's occurring or until it becomes catastrophic. We want to avoid pain. We want to avoid you spending money. So seeing us regularly, just for a simple cleaning and checkup and having us spend 40 minutes to an hour looking in your mouth and cleaning everything up would prevent a lot of money and a lot of time on your hands.
What can you tell a patient who is embarrassed about the fact they haven't been to a dentist in a long time, but they think they have something going on?
Come in, let me take a look at it. Let's talk about it. The first appointment is just talking about the problems, talking about the solutions, the advantages, disadvantages, and then we hold your hand in whatever decision you like to do. There is no judgment on my side. I'm simply here to help you become healthier. That can happen quickly and for the least amount of money. The link between oral health and systemic health it's real. Multitude of factors or systemic diseases that are associated with your oral health. The most direct link would be diabetes. Uncontrolled gum disease and uncontrolled diabetes go hand in hand. If you control one, you control the other. If you have uncontrolled one, you have uncontrolled the other. There's also significant correlation between cardiovascular disease, stroke, cholesterol, premature birth. The list goes on and on. It's really important that we address oral health issues because the systemic causality or link with oral health. I got into dentistry because I like to help people. I really just want to use my skills, my knowledge, and my hands to make my patients healthier. So if you can go somewhere else and get better work, I 100% encourage my patients to go do that. Mexico is not that. There's a lot of uncontrolled or unregulated things that occur in Mexico. And so if we're doing these bigger treatments, and I have seen some dentistry come from Mexico that's okay. Still don't know what it was, but it looks okay on a radiograph and clinically it looks good, but the longevity of it is unknown. If I'm investing any sort of money, I want it to work. And so I just don't think it's a good idea to be doing these larger things in Mexico because A, you don't know what it is. There's no regulations on the materials they use, and you don't have that follow-up that is needed. So although you may be saving a little bit of money by driving down there, long-term, you're gonna be losing a significantly more amount of money. In my practice, I've seen a lot of implants come back from Mexico that are failing within 3 months, and they return to Mexico to be told, oh, it's okay, and just give antibiotics. And then 3 years later, I get brought into the picture and it's just a catastrophe. There is bone missing and you not only have to start at zero, you have to build everything back up. So that's why I just don't recommend going to Mexico to get your dental work. Another thing that is concerning to me about going to Mexico for dental treatment or any treatment of that nature is the follow-up. I touched on that before, but anytime you have major work, let's say an all-on-4 or even just a simple implant, no other dentist is gonna be able to give maintenance or routine follow-up of that because they A, don't know what it is, and B, it's not their work. So that's going to have to be another trip that you're going to have to go back to Mexico. I touched earlier on quality control with products, but you also need to know quality control with the providers. In the United States, becoming a dentist is very hard. It requires a lot of school, a lot of testing, a lot of certifications, and a lot of continuing education. In Mexico, those regulations aren't there. So while you might be seeing an American trained dentist, there's a reason that dentist is not working in the United States. So just be careful. Since an early boy, I had learned that I do not like to share. But in Arizona, I have a lot of patients that come see me during the winter and travel back north during the summer. And so I have to share. They have a dentist up home and they have a dentist in their second home. We coordinate that very well. My front office, we send x-rays back and forth. We send clinical notes back and forth. Heck, sometimes I even do an implant in my office, place the implant, send the patient home with all the parts to get it restored. So their dentist up north doesn't even have to order the parts or look up the implant. It works out really well.